I'm going to stand up here because I'm doing this talk with Dr. Sheilah Robertson, and so she's like, they won't see me if I'm down there. So, but I realized I could be down there. We're almost the same height. So this talk is about those situations that you have. If you've had them, then you know what I'm talking about, is when you've given the euthanasia solution and their heart just keeps on going, right? And internally you're like, what? Oops, sorry. We're going to break this into three quick sections, and the first is just a story about Frida, and then Dr. Sheilah, who's our medical director and anesthesiologist, is going to talk about the process of how the euthanasia, works, and then how to handle these situations, because it's kind of awkward for everybody. And with Frida was a lab that I went to go see. She was kind of younger, and she had a nasal tumor, and I hit the cephalic. It was perfect, so it was not any alternate route. I gave the appropriate dose. It completely went in. I had a flash. I removed my butterfly catheter, and I'm like, we'll just let here she goes, And her, breathing slowed down, and it slowed down a lot, but that heart would not stop. And every time I went to go listen, I just kept hearing it, and it was very unsettling for the owners. It was for me as well. I was sweating all over, and there came a time where the owners finally said, like, well, did you give them the right amount? Did you give her the right amount? And and so then they start doubting, because I've prepped them for a certain expectation of time, and the heart is still going on. And then they, well, this didn't happen the last time at my veterinarian, and so it just kept getting worse and worse. And I almost hated to go in to listen to the heart, because it just kept on going. And it was maybe like 15, 20 minutes, which like for me was an eternity. And I hated it, because also then they said, and I set their expectations up, but a lot of times owners say, well, isn't that medication you're giving the one that's stopping the heart? And if the heart keeps going on, they're gonna look at you that like there's something wrong with what you've done. So now we're gonna go to Sheilah.
Yeah. So it's just, I think if someone does ask you if you're giving the injection that stops the heart, I think it's very important that you tell them that's not what you're doing, because a lot of owners, would equate that with that you're stopping the heart, but they may not be asleep when that happens. So I think it is important to tell them, no, it's not the injection that stops the heart that I just gave. So how do euthanasia solutions work? You use them a lot, and what they probably would understand is that you can tell them it's like an anesthetic, but a much, much higher dose. And you could tell them, anesthetics don't usually stop the heart, but this one we're going to give enough that we're going to get the animal very, very sleepy, and that will then go into a whole, roll of things that will eventually shut down the heart. So I think it's important to tell them that the injection we're giving is going to shut their brain down. And that's true. So what we do is when we give that high dose of euthanasia solution, the brain shuts down, and the brain is the controller of the lungs. So then the breathing is going to slow down, and then they'll stop breathing. And then what will happen is, because the controller has been shut down, the brain, then the heart, if everything goes well, is going to stop beating. But it's important they understand that process, that the animal has gone to sleep or is like having an anesthetic. So what you'll find though, because I've been done a lot of anesthesia where obviously they need to wake up, not like my new job. So what you'll find is you'll lose the pulse very, very quickly, but the electrical activity in the heart will keep going. And so if you were in a surgery and you had the EKG on, that EKG can look normal, and my record so far is 9 minutes of a normal looking EKG, but the heart's not actually functionally doing anything good. So there's things to figure out, like Mary's situation with Frida. Why didn't it go as fast as it should have gone? So let's think about the two things that are going to impact on how fast it all happens. It's going to be the distance between where you give the drug and the speed that it arrives at the brain, right, where it starts doing its job. So distance and speed are the two factors. So if you think about it, we may have a catheter in, usually as a butterfly for euthanasia, and we need to get from A to B. So the injection site, we've got to get to the circulation, to the heart, to the brain, boom. Then it starts to work right at the brain. So if you think about some of these dogs that you might have sedated with an alpha-2 agonist, remember cardiac output goes down, heart rate goes down, or they're very sick and have poor circulation. So I think it's good to have a visual about thinking how things have slowed down. So if you think about the normal, happy, healthy dog, good circulation, but think about how slow things are moving after sedation and in a very sick animal. So I like visuals. So it's almost like if you think about how quickly your drug is reaching its point of action, think about whether you're delivering it on the high-speed train or it's coming on the slow train. And so the high-speed train is the young, healthy animals. The slow-speed train is the sick, slow-moving circulation, just slowly getting there. But the other thing that also is going to impact on how it works is if the circulation is going really slowly. So that drug is, you're injecting it, but it's trickling in and it's slowly making its way to the brain. So it's like trying to fill a bucket, because what you want to do is fill the brain, boom, with pentabarb, right, to stop and shut down the brain. But it's just trickling in, whereas in the healthy, good circulation, boom, it gets there. So the distance it has to go, how fast it gets there, and the fact that in these sick animals with bad circulation, it's not filling up the bucket, the brain, boom, just like that to do its job. So that might help you talk through some of these situations with the owners. That was quite technical, but you could explain to them, it's the fast train or the slow train, and that might really help them understand why things are happening the way they are happening.
Excellent. So as medical as you can get, sometimes you're just like, this sucks. And you might actually wish, please just die. Like sometimes in my brain I might think that, and I hate to say it, but I want them to pass. So how do you handle these situations? And I think that's the hardest part of it all. And you might have that pet, like Frida actually wasn't that sick. She was running around, her tail was wagging. I got a vein that was pretty close to the heart and went to the brain. But sometimes Mother Nature just has another mission, and that's to make your life a little miserable. So first and most importantly, when you're ever in these situations and you've got that whatever awkwardness that is among is a part of the moment, is to remain calm. Okay, so that's number one. You always got to make sure that you don't freak out, and as Dr. Danny said, don't have the normal face. You have to look like the flight attendant, and like, this is okay, it's fine. And so for me, it's setting myself up for success before I'm even injecting the pet, because it could be intraperitoneal and they pass fast, even though typically they pass, they take a long time. So it could also be the other way around, where you say, oh, we're going to have, it's about 5 or 10 minutes, and then boom, they're gone. Even same thing with sedation. I might say that, it takes about 5 or 10 minutes for sedation, and then 30 seconds later, that cat is just flat out. So we can never totally guarantee in either direction. But for me, it's setting this, is don't overpromise a certain route. And so when I'm giving my spiel, let's say, right before I do the euthanasia, and I'll say when he's calm and comfortable from that first medication, I'll figure out the best route to give the second medication. And I don't talk about time there. Now, I've just told the family I'm going to give them the best route, whatever that may be. Now, of course, if I'm looking at a dog that I know I'm going to go intrahepatic, or I know I'm going to go intracardiac, I'm going to talk about it then. But sometimes those veins are looking at you and all beautiful, but really they just wobble right away from you. So I just want to give them, just to set myself up to say I'm going to give it the best route. Now, when I'm approaching for that route, I say, if I get this vein, they'll pass within a minute or two. And in Frida, she didn't pass in a minute or two, and it was driving me nuts. But the other routes, of course, are going to typically take longer. So I just always want to explain that first. But what happens, what do you say when the heart still goes on and they're expecting death to happen fast? Especially like with Frida, when I was in, it was for sure in her vein. So first is just to think about some things not to say, and these aren't necessarily wrong, but we say them and they could be taken a little bit wrong. And the most common is, he's fighting it. And the owners will maybe say that, right? So, oh, he's fighting, he doesn't want to leave, you know, so that's not good. And we've had a veterinarian or a client call us to say, we didn't use your services. It was another veterinarian, and it was for the sedation, and he was fighting it. And so owners don't want to think that they're struggling against anything. I've never seen this before. Okay, you don't want to say that. Instead, I like to say, this can happen. It's happening right now. So there's no lie in saying that at all, because, yeah, you never saw it before, it's happening now. He doesn't want to leave you. And sometimes people say that because they think it's a little bit softer, but, that can kind of put a little eek in the owner's mind, make them feel a little bit emotionally uncomfortable about it. The medication is taking a little longer to work. This could make them think like you didn't give the right medication or something is wrong. And again, it's not necessarily wrong to say these things, but sometimes, it might sound different in their brain. And there are the moments that you have these pets like this, you want to just, like in your brain, you're like, I just got to say something, right? So have what you want to say just solid in your brain. Don't worry, she's feeling great. Okay, because you probably said before at some point, well, like, he's going to be unconscious, so he doesn't feel anything, right? And now you're saying, don't worry, she feels great. Okay, you just contradicted yourself. So I don't say if she's feeling good or not. They're comfortable, right? Either way, they're always comfortable. So what can you say? There's, look at my little arrows are out. There's not one great way to say this, but I want you to just have what sounds organic to you, just in your brain, so that way you're prepared when it comes up. Some of our veterinarians have given their suggestions to us, and we've got some extra time to say farewell. So we've got some extra time. And what I like to say, or what I like to think of, is just be confident with whatever you say, and not sound wishy-washy. And I just look them in the eye. We've got some extra time. And they usually don't struggle. It's when I'm like, this is what I typically say. It's similar to taking someone off of life support. It may be quick and it may be slow. And that's what happens in life support when they take somebody off. They could pass right away. It could take 2 hours, hours at time for the body just to slowly shut down. One of our veterinarians says, that strong, beautiful engine has been running for so long, it may take a little longer to slow to a stop. But just have it ready and be prepared in your brain on what you want to say, so that way you can say it confidently, even though internally you're like, your pits are sweating and you're just like crawling inside. But regardless of what you say or how you say it, if you've set the appointment up for success from the beginning, so if everything else is beautiful, you're going to be buffered from this, this awkward, experience. And the people who answer our phones, our care coordinators, are amazing. And they set me up for success. That way, if something happens medically, because that's one thing I almost can't guarantee control over, right? I can't guarantee that pet will pass. I'm pretty confident at the timing, but I can't always guarantee it. But if everything else has been perfect, from the phone call to just the way that my car is, looks, or my bag is looked, and the way I say things, that way if something goes a little off kilter, they may take it better. So our care coordinators, our families call us and send thank you notes in, and they'll say, oh, Lori was amazing, and so was the vet that came, right? So they don't even remember my name sometimes, but they know who called. So if you're able to set the expectations up early when you're in that appointment, but also have it from the beginning to the end really good. If something bad goes wrong, it's going to buffer it a little bit, and so it's taken better. And so with Frida, that was bad for me, because I wasn't confident what I was going to say, and she took a really long time. And so in those cases, I just made an effort to do extra. I hand delivered the urn. Like, I just went above and beyond, because I knew that they had the thought in their mind that I did something wrong. And for me, I also, in what we do, I always want to reach out to the regular veterinarian or the primary care doctor and let them know, and just say, she took a little while to pass, just in case they have any questions, come and ask me, because I don't want them to call their regular veterinarian and they'll be like, what? That's never happened to me. Because it's going to happen to all of you. The screamer is going to happen to all of you. It's going to happen to all of us as well. So do you have any questions? That's our little 15. How do you respond when the client freaks out? That's for any situation, right? Or like, how do you respond? It's really how they're responding, and sometimes it's just their emotion or their way they're dealing with their grief. And I've had some people that have yelled at me and things like that. I had my screamer, for instance, right? She's screaming. I remember Charlie. He's screaming. I said, he's vocalizing, right? So I got to switch the words around because vocalizing sounds way better than a scream, right? So Danny gave you a lot of answers or suggestions. So I've got a Rolodex of like how I handle things. But you have to understand where they're coming from. And half the time it's guilt. But normally we don't experience that many like crazy screaming at us. But there are going to be they're vocalizing, right? You just do the best you can and help their concerns. Yes, last question, then we'll. So she says sometimes it takes a little more. So what I do is I never say I give them more. I say I'm going to give them the rest. I planned on that. Right? So last question, because I know that you had one too, and then we'll go. Right. Okay. So the highly aggressive one that's difficult to sedate, not even aggressive, the ones that are difficult to sedate, we use really good sedatives, and so we are IM or sub-Q. They're going to sedate. So we never really have now, do they sedate well enough where they're always like sleeping? And I never promise to sleep. I say he's going to be calm and comfortable. And those that have respiratory distress or the high-strung ones that are like high, pain, where they can't almost, I don't say they're going to be totally calm and comfortable. I say he'll be comfortable, but he may not totally sleep. And those are the ones, respiratory distress will always have their head pop up, right? And that's why I never promise sleeping, because you cannot promise sleeping. But we give a really high dose. And if I've got a massively aggressive dog, I mean, it's xylazine, it's a large animal dose. I don't even care if I don't want them to vomit, but even if they vomit, I'd rather them, have that happen, and then we clean that up real fast and just knock them out. But what's awesome about sedation is that they usually snore, and then the owners will usually say, this is the best sleep he's had in a while. And that's why I love sedation, because I want them to see that comfortable sleeping if it can happen. And so if I get a snorer, it's like, oh, thank goodness. I want them to lick my face when I come in, and I want them snoring in 10 minutes after I give an injection. All right, so I think that's it. We have our 3-minute break, and then we're going to do the aquamation.